Every day in America, more than 6 billion prescriptions move through a system most people never see, yet deeply rely on. This is the world of pharmacy benefit managers, or PBMs. PBMs were designed to help patients get the medications they need, affordably, efficiently, and on time. That mission remains, but the system has grown increasingly complex, often creating distance between providers, pharmacists, patients, and the care that truly heals. Today, 3 companies manage nearly 80% of the PBM market, playing a critical role in determining access, cost, and delivery of medications. In a system this intricate, change can feel out of reach. But innovation isn't just possible, it's already underway. This is EmpiRx Health, a clinically driven PBM that puts care, not cost structures, at the center. Here, pharmacists lead the care journey. Every patient is seen as a person first, and decisions are made based on what's truly right, not just what's routine. At the heart of it all is a powerful belief. Healthcare should meet people where they are and move them forward with care, not complexity. This isn't just a story about prescriptions and pharmacies. It's a story about purpose, progress, and a future we all deserve. Welcome to 11 Minutes. Traditional PBMs are designed to manage prescriptions. EmpiRx Health is designed to understand people.
Over time, what's happened is the model has shifted to profits first, and now it's really hard to find your way back from that. Our model is very different in that we try to really focus on the patient and not lead with profits, but really believe that if you do the right thing, everything else will follow.
What makes it such an antiquated industry that needs to be transformed?
Pharmaceutical companies are pushing drugs out the door, right? 80% of what's coming down the medication pipeline are specialty medications. The average cost of those medications now are $300,000 plus per year. And that's what they're focused on driving. When partnered with a PBM, their goal in trying to drive profits is to push those very expensive medications out the door. And that's not putting the patient first, because you might not need a $300,000 biologic to treat your condition, right? You may need a $5 generic that's been out for 20 years that can satisfy your conditions.
EmpiRx Health believes that if you put the patient first, everything else will follow.
When you stop putting rebates first and you stop trying to drive volume and you say, hey, I'm going to create interventions to help the patient get to better care, then you have a right to play in other things that improve patient health. At EmpiRx, we stop and ask the question, should you be on this medication? And let's partner with the physician to make sure that you're on the medication appropriately. And if there's things that you need to do to modify behavior, so an example is, we have programs that help patients earn their way into a GLP-1 drug, right? Are you eating properly? Are you dieting correctly? And if you are, then your employer is willing to make the investment.
For Danny Sanchez, this isn't just work. It's a mission grounded in lived experience.
Can you tell us a little bit about your individual passion? And was there ever a moment that said, hey, I want to be in this place because it's an industry that I deeply care about and want to make a difference in it?
I have been in healthcare my whole career. And my first job was at Eckerd Drugs. When I look back at those times, I remember the frustration in seeing patients come in to get their drugs. Particularly, end of the day, mom, dad, you have a sick child, you show up at the pharmacy and disappointment. Prescription has a prior auth, nobody called your doctor, they don't have it in stock, and nobody shared that with you to say, hey, you may want to call your doctor and change your prescription, or let me do that for you. I remember being young and seeing that and say, I really want to try to fix this if I ever have an opportunity to do that.
The other piece that seems to be lost in the PBM world today, the idea of putting pharmacists in the center of care. What are you guys doing in that space?
We employ well over 60 frontline pharmacists. And I say that because it is unique. No other PBM does that. To my point earlier, where you have 97% of PA rate approvals, so PA being prior authorizations, we're much less than that because our pharmacists are at the center of care.
Can you give us a real-life example of how a pharmacist first model prevented some type of a complication, some kind of a serious issue?
Physicians today are visited by drug companies every day, and those drug companies are showing up with pre-printed prescription pads on their latest drug. And most of the time, those drugs are pre-printed to the maximum dose for that drug, because the maximum dose for that drug is what drives profits into those pharma companies. We have examples where our pharmacists have intervened on patients to say, why do you have Danny on this maximum dose of this drug when his labs show that he could be dosed at half of this? You know, that does many things, right? That saves you money as a consumer, it saves you money as an employer, but the patient won't have as much of a side effect, right? Because these medications do come with severe side effects. And then that has downstream consequences to say, if I'm not feeling nauseous every day or if I'm not feeling ill, I'm more likely to be adherent on the drug and get to a better health state.
Great decisions require complete insight. That's why EmpiRx Health built Clinically, a proprietary population health engine that ingests everything from medical claims to lab values to determinants of health.
You all built a platform, Clinically, and you decided to do it in-house. What was the driver behind that?
Clinically is a culmination of many different pieces of technology. The driver really was, we want to put information in front of the pharmacist and as much information as we can so they can make informed decisions. It is a population health engine. It is ingesting information from multiple sources, and it is serving that up to the pharmacist. And uniquely positioned in that it can ingest not just PBM information, it is ingesting medical claims, it is ingesting lab values, determinants of health. You know, it's designed to paint the best possible picture so that a pharmacist can serve kind of as a nexus to help the physician make the right decision for the patient. You know, we don't prescribe anything for patients. All we do is take that information, place a phone call to the doc, and make a recommendation. And you know, over 70% of the time, a physician will react to that and say, hey, thank you, that's great, I'm going to change that prescription.
You're a growing company. How do you ensure, as the vision moves forward and mission, that technology doesn't become essentially an adherent to growth and patient care, but it continues to enable what you're trying to accomplish out there?
We do a really good job within our product organization to paint our roadmap. Across our product portfolio, every product has a 3-year roadmap, and that is a tie into what technology we have today, what technology we need to look at into the future. Our view is technology enables us to do more, and we're constantly thinking, how do we evolve and get better every day?
And it sounds like you are not afraid of AI and the tech advances that are coming forward, and will continue to look to that as part of the enabler of the bigger mission.
We are not steering away from that. We have to step into that, understand it, understand how it's applicable, understand when we want to apply it or when we actually want to make sure we keep the pharmacists there and their eyes there. And so I think it's finding that right balance. I think we're all dabbling in it a little bit, but to be able to master it and say, hey, where does it make sense for the business? Where is it safe to apply? You know, we want to continue to empower our pharmacists and give them more information. And AI is a great tool that you can ask a question and get an answer, you know, versus spending hours looking through a facts and comparison or having to read the latest study when you have technologies that have ingested that information and can give you a summary in a moment. And so it makes us more efficient, it makes us smarter.
As PBM reform gains momentum, EmpiRx Health isn't just preparing to adapt. They're already there.
When you level the playing field and you say everybody needs to stop playing PBM games, which companies are really saving employers money and helping improve patient outcomes? EmpiRx is one of one. You're the company that is driving that model. There's nobody else out there doing it. So, you know, I welcome change. I welcome some regulation to step in and help level the playing field. To me, it's not just what we're doing, but enabling others to understand the model and adopt the model. We have an opportunity here to say, hey, let's take a step back. This is a model that improves healthcare, drives down costs, and is good for everybody. If we can teach others to do what we're doing, then I hope that we can drive industry-wide change. It's not just about EmpiRx, it's just the right thing for healthcare. If you do the right thing, everything else will follow.
In a system shaped by incentives, EmpiRx Health chose intention. In a business built for complexity, they built for clarity. And in an industry driven by volume, they put a face to every dose. Because this isn't just about managing medication. It's about restoring trust in the most human part of healthcare. One prescription, one conversation, one life at a time. EmpiRx Health, flipping the script on pharmacy care.